Hi, Katie. My name's Ashley. I just want to teach you a little bit about peritoneal dialysis today. Do you have any questions?
Well, I guess I don't understand what dialysis or what peritoneal dialysis does. Can you tell me more about it?
Sure. So peritoneal dialysis is one of 3 modalities that is offered here at Gundersen. It uses your peritoneal cavity to dialyze. It does exchanges within the peritoneal cavity. Fluid and dissolved substances are exchanged within the blood. Dialysate is a mix of sugar, water, and the electrolytes. Excess fluid is removed, electrolyte imbalances are corrected, and toxins are removed. There are 3 phases to complete an exchange. The first phase is drain, the second phase is fill, and the third is dwell. During the drain phase, dialysis solution and excess water and waste drain into a bag. The fill, the fresh dialysis solution flows into the person's belly, and the dwell, it stays there for a certain amount of time where it collects excess water and waste.
Do most patients do this during the day or at night?
Yeah, so actually with peritoneal dialysis, there's a lot of flexibility with it. Most of our patients do it at night, but it is definitely an option for them to be able to dialyze during the day as well.
Okay. And is there a machine that does this?
Yeah, so actually, as far as the machine goes, this is our dialysis machine. It's very portable. Actually, when you start out, it can be tucked away like so. And then there's actually only 3 buttons on the machine, so it makes it very user-friendly. You can pull out the screen here, and you turn it on, and there's only 2 things that you have to do, or open up, I guess you should say, to connect the lines. And this is something that we would go over in depth more in your week-long training that you'll have with us.
Okay.
So we would connect the lines in here. It closes up very easily. And then it actually has the screen that talks you through step by step how to connect your lines, how to hook everything up. It just gives it kind of verbatim so that you don't get lost along the way.
Okay.
This is your solution, the dialysate that you would use. As you can see, this one is yellow. We do have a couple different colors. We have yellow, we have green, we have red, and then we have a purple. Each one has a different concentration of dextrose solution in it that kind of helps with determining how you're going to dialyze for that treatment. So typically we start off on a green solution, and then if you're a little bit too dry, we're pulling too much fluid, or you're dehydrated, we'd use the yellow. And then if you have too much fluid, we would use the red solution. Then we got the purple, and that would kind of be an all-day dwell, but typically our new patients don't start off on something like that. So then we would be able to educate you on that further if you ever needed it.
So all of that fluid would go in my tummy?
Actually, not all of it. During the cycles that your provider prescribes for you, they'll let you know how much fluid you'll need for your treatment. So basically, most of the time, I think our patients go between 1,500 milliliters and 2,000 milliliters on average, but it always depends on the patient.
Okay. And I guess how does it hook up to my body or my perineum?
So your PD catheter will be placed by a surgeon. It's a same-day surgery, and it will look something similar to this. So you got the catheter coming out of your abdominal cavity there, and we would educate you further on site care and dressing changes. And then the catheter as a whole that is placed on your surgery day looks something similar to this. So this will be in your peritoneal cavity. It's got cuffs here to kind of hold it in place. And then this is about how much you would maybe see coming out of your abdominal cavity. It's easy to bend, move around. This is where we would hook up for our treatments. It's got a cap. This is sterile typically, and we'll go over that more in education. And then this is the clamp that we use. So that is unclamped and allows fluid to move freely, and this is clamped, and that will not let any fluid in or out of your peritoneal cavity.
So Ashley, what are some of the pros of peritoneal dialysis?
Pros to peritoneal dialysis, there's actually many. It offers you a sense of freedom. I know that it's a big lifestyle change for you to transfer over to dialysis in general, but you are able to travel on peritoneal dialysis. It comes with a traveling case. We work with a company called Baxter, and they are very, very good at helping with setting up your vacations so that we can have those supplies maybe shipped to wherever you're wanting to go to. They also offer, Baxter as a whole is very easy to work with. We have a lot of connections, so if you're concerned about your clinical well-being, you can always call the peritoneal dialysis nurses. And then if you're concerned about any of the troubleshooting with the machine or the supplies that you get, you can always call Baxter. They're also very helpful as well. Okay. Peritoneal dialysis is also very gentle on the body. We do it daily, so it helps a lot with, maintaining your electrolyte and fluid balances in terms of going on hemodialysis and only being able to go a few times a week where you're pulling off more at one time. Your body is able to handle, and your blood pressures are able to handle this kind of dialysis a little bit better.
Good. I guess what are some of the disadvantages of peritoneal dialysis?
One of the biggest issues that we run into on peritoneal dialysis is peritonitis, which is an infection within the peritoneal cavity. We strive very much to educate during that first week on how to prevent this from happening to our patients. In the long run, if it were a recurrent thing or peritonitis was very severe, it could actually ruin your peritoneal cavity and you would no longer be able to do peritoneal dialysis, and then we would be able to talk about other modalities with you. Otherwise, as a whole, peritoneal dialysis is a very good way to go.
Okay. So it looks like I need some space for supplies, I guess. And where does the fluid drain when it drains out of my peridium? I guess what are some of the things I need at home to be successful?
Yeah, so we will be able to help with setting up supplies and supplies being shipped to your home during treatment. But one of the biggest things that we're going to need is the machine. This will do all of your dialysis for you. It performs all of the cycles that are required for peritoneal dialysis. So really, as a patient, you would just have to connect and disconnect from the machine. Okay. You'll also get quite a few boxes of each solution. That first initial order is going to be the biggest order that you will have. So we ask and we request it when we do our home visits that there is space for the boxes for all of our supplies and our solutions. The next thing that you're going to use is the cassette lines. And this is actually the lines that you're going to set up in the machine. Okay. So we would go over that in education as well. And then right here, this little green one here is called the patient line. And this is actually the line that would attach to your catheter coming out of your body. The last thing that we typically need, besides all the other little miscellaneous items that I'll go over, is the drain bag. Now, you have two options on peritoneal dialysis. You have the option to either drain into the toilet at your home if you have enough space or length from where you're going to be dialyzing to where your toilet is. Otherwise, you have the other option of using a drain bag. And this typically holds up to 15 liters. But each package comes with two. So depending on your dialysis prescription, you may use two, you may use one. The only downfall with the drain bags is that they do get quite heavy when you're trying to drain them back into the toilet after your treatment.
Okay.
So that pretty much sums up.
I guess how much storage would you say?
So on an estimate, we usually say on a wall maybe about 7 feet or so in length. It'll probably come out about a foot or two from that with those boxes, and then maybe about 4 feet high. That's just a rough estimate, but it'll give you kind of a good idea of what kind of space or which area you would like to keep them in. You can always keep them stored separately too, as long as they're in a clean, dry area. That will also be acceptable too if you have them in two different spaces.
So my doctor says I need to get started. What is my next steps?
Yeah, so now after you've completed the educational process, we will be able to move forward to the home visit process. During this time, please know that we're not coming there to inspect your home, make sure it's clean, super clean. We're just there to make sure that we check off on our checklist as far as the necessities of peritoneal dialysis moving forward. So we're just measuring to see how far it would be from your treatment area to the bathroom, or what space we're going to need next to your bed if you choose to do it at night, so that you can have the machine and the solution bag there. So we're just kind of checking off our list. You're able to have animals, but just know that when we come for the home visit that they're kept locked away until we're done. But with that, you can have animals as long as we can confirm that they will not be in the treatment space before,
okay.
during, and after treatment.
Got it. Okay.
After the home visit, then we will let the doctor know that you are ready to move forward with PD catheter placement. They will be able to put in the consult to get that done. And then from there, we would be able to have the surgery completed. That's the same day surgery. One of our PD nurses will be able to call you before that is taking place.
Okay.
And then we will be able to go over any kind of catheter care instructions or what to expect after surgery. Then after your surgery is done, we will meet with you again, give you some supplies to take home, some extra tape if your dressing comes off, anything like that. And then we will be able to give you your schedule from there as far as what to expect moving forward. We do weekly catheter rinses until we are able to start training. Our training is Monday through Friday. Monday through Thursday is here in La Crosse, and then that Friday is a home visit where we bring the machine to your home, and we are able to set it up with you, make sure that you're comfortable, make sure you have all the supplies you need. And then, from there, you're one of our PD patients, and you can call us with any questions or concerns.
So how do you support me as a patient going forward with peritoneal dialysis?
Sure. So you have a very big support system moving forward within our dialysis team. For starters, you have us as a peritoneal dialysis nurses. We are available Monday through Friday from 7 to 4:30. We also have nurses on call after hours, so any kind of emergencies, we have someone available to help you. And then we also move forward with the monthly clinic visits as well. During this time, you will meet with the social worker, the dietitian, the registered nurse, and then the nephrologist as well.
Okay.
And we'll kind of go over your care plan, how we feel about your dialysis, what the plan of care is moving forward. We review your labs, and if you're on the transplant list, we also discuss that. So we're just there as a big support system to help you with any of your needs moving forward.